we got to start with some business. And that's where we start with a very simple but disturbing question about whether the Biden administration is being transparent, is being honest, and is following the science in the mandates it's handing down and recommending, in particular when it comes to masks. At least that's the focus today. A troubling new report from The Atlantic by David Zweig on masking and kids just out, and it raises serious doubts about the CDC's transparency. Earlier this year, the CDC widely promoted, Rochelle Walensky touted a study out of Arizona that suggested mask requirements in schools in particular had a dramatic impact, really helped stop COVID outbreaks. This moment, make no mistake about it, is being used by maybe your school, my school, and other schools all around the country as the reason your child has a mask over his face all day. All right? So this is an important moment. The author, the journalist, David Zweig, he's both conducted a months-long investigation into this study so beloved by Rochelle Walensky, and has concluded with the help of some 8 or 9 experts that it is, in his words, quote, profoundly misleading. David is back with us now to talk about his latest reporting. David, great to see you. So let's just, before we get to your research, set the stage for us on, you just sort of open the piece by saying, when they approved the vaccines for 5 to 11-year-olds, many of us, I know I did, heaved a little bit of a sigh of relief thinking, oh, okay, at least the masks can come off. The mask will come off. Guess again. And you compare how the United States is with its children in the pandemic versus other countries. Let's start there.
Yeah, there were a number of experts who started pointing out once the FDA approved the vaccine for 5 to 11-year-olds, that this would be kind of, here's the line where we draw in the sand. Even the people who are really pretty, staunch pro-mask or pro-other mitigation measures, they said, look, now that the kids, have the opportunity to be vaccinated, once, X amount of weeks go by or months where everyone's had the opportunity to do so, that's it. It's time to start unwinding some of these things. I should point out, by the way, that even children who are unvaccinated are at lower risk of hospitalization and severe disease than many vaccinated adults. So
that's huge.
Not every expert was saying that we had to pin this on that, but nevertheless, just wait.
I do, and I'm going to let you finish your point. But we don't spend enough time on that because we see all the kids sitting outside eating their lunch in 39-degree weather, and then you see the grown-ups, Kathy Hochul, the governor of New York, many other officials, maskless inside, enjoying their meal right next to somebody, and we say, "This is BS," and the response you always get is, "Hello, it's called a vaccine. That's the difference. She's been vaccinated. Your kids haven't." And number one, a lot of the kids have been vaccinated who are forced to sit outside on those buckets. But number two, your point just now, even unvaccinated, those kids are less likely to contract and spread COVID than a vaccinated grown-up is, like Kathy Hochul.
That's correct. The age stratification of risk is so extraordinary. It's hard to even visualize or process for most people. So it's understandable, perhaps, that a lot of parents would think, hey, I need my kids vaccinated. I understand kids are at lower risk. That message kind of made it through. But nevertheless, they still needed that security of the vaccination for them. So I could see why people had been thinking that. But the fact of the matter is the data simply show otherwise, which is that even unvaccinated children, there's really excellent data out of the UK on this. And we see some data on this as well in the States in different places, that it's very clear that even unvaccinated kids, particularly unvaccinated healthy children, statistically are still at a far lower risk of severe disease or hospitalization than many vaccinated adults once you get past a certain age. So we should just kind of clear that up right now, that to my mind and that of many experts, we shouldn't be pinning any of this on child vaccination simply because the risk for them, even while they're unvaccinated, is still less than the adults. And the fact of the matter is that I think you pointed out that you have adults who are, in New York State, for example, who have the liberty of eating in a restaurant without a mask, who have the liberty of conducting their lives in a relatively normal way, yet the children in school don't have that same liberty. And you cannot pin that on the notion of vaccination because the statistics simply show otherwise.
Mm-hmm. So the United States is cracking down on its children in a particularly aggressive way. And, to many of us, it feels cruel and abusive. And they continue to do so no matter what the data show. They just continue to mask them. Now it's mandatory vaccinations. The LA Unified School District has just had to postpone its mandate on vaccinations because some 30,000 children hadn't gotten it. So it was like, they're not doing it. Parents are reluctant. They don't want to go first. A lot of parents have reluctance when it comes to their young ones. So that's where we stand with respect to the children. America's doing it in a really aggressive and I think unkind and cruel way. So enter the second piece of this, which is, well, the science. The science. I mean, we don't mean to be cruel. We don't mean to be more stringent than the other countries. But the science says this is going to keep your kid safe. It's going to keep your kid from bringing COVID home to grandma. And that is why we have to put the cloth over their face all day long. And they have been citing, in particular, this one study from where?
Right. So what my feature in The Atlantic focused on was this particular study that was conducted in Arizona, roughly 1,000 schools there, and they compared schools that had mask mandates in place from the beginning of the school year to schools that didn't have mask mandates. And the takeaway finding from the study was that the schools without the mask mandates had 3.5 times more outbreaks during the study period than the schools with mask mandates. So this was, a really startling statistic, and it's something that was covered widely. It was in every major media outlet in the country, and Rochelle Walensky, the director of the CDC, was on television talking about it. She did mention it multiple times in White House briefings, over and over and over again. You kept hearing this statistic 3.5 times. And that's kind of where I begin my story.
All right. So we have her. She went on, as you point out in your piece, she went on CBS Face the Nation. She went to the White House briefing. She tweeted it out. She went back on TV in October. She was on, this is the soundbite with Chris Hayes of MSNBC in late September. Here is her message.
The big finding is that masks in school work. We've only had in some school districts about 6 weeks of school, and we've already had, in a different study that was published today, over 1,800 schools closed. Nearly a million children have been out of school because of school closures. But the study that you're referring to in Arizona demonstrated that schools that had masks were 3.5 times less likely to have a school outbreak than schools that didn't have masks.
Just to follow up, are we sure that's not a correlation issue and not a causation, which is to say, like, there's higher levels of community transmission in the school districts that are also the ones most inclined to not have a masking policy? See what I'm saying?
Yeah, no, and that's actually been studied as well, and we've examined those correlations for exactly the concern you raise. This is an independent effect of masks.
Wow. Go ahead, David.
I hadn't seen that interview. That is astonishing. The study uses the word association. So unless I misunderstood what she just said, she seemed to be implying that it wasn't merely an association,
right,
but rather something causal. And a number of experts would beg to differ. So, but boy, I'm still kind of taking it in from that interview. I mean, that really exemplifies kind of the broader thesis of my feature and kind of the larger idea that the CDC really has doubled down on, and we see this in a variety of areas, but specifically with masks, the evidence is incredibly shaky. We don't know. I'm not definitively saying they don't work. What I am saying is, it's by me saying from what all the experts I interview are saying, is that the evidence simply does not say what the CDC is suggesting. And again, the language in this study itself, they specifically use the word association. Another one of the big studies, which I had written about before, the authors of that study similarly say, this is not meant to infer causality. So these are important, nuanced words here.
Explain that for those of us who are only paying half attention to this. What are you saying right now?
Okay, so, I mean, basically, many things happen when you're doing a study in the real world. And the magic is being able to tease out what are sort of these confounders or these variables that might be influencing something you're seeing versus what are the actual cause. So that's causal versus just an association. We might see that kids in school have fewer cases of the flu, and they are all wearing masks, the windows are open, and they're running HEPA filters, but they also are all wearing sneakers. And we say, look, by wearing sneakers, that reduces the case incidence of the flu. It's not a perfect analogy, but it's the point that we don't necessarily know what's causal. So that's one element of this, but that's really kind of the tip of the proverbial iceberg regarding this study, which was why I became so fascinated with it and began investigating it.
Mm-hmm. And she seems to be saying in that soundbite with Chris Hayes, no, the masks, they are the cause. The absence of masks, that's what caused the COVID outbreaks, or in the other alternative, that's what prevented them.
She seemed to be suggesting that. Yeah, I hadn't seen that interview before. I'm going to watch it again after we talk, because I'm quite curious about it. But so the main, sort of soundbite is this 3.5 times that she mentioned there, and I linked to a handful of other times where she mentioned it. And the thing is, there's really nothing in this study to support that finding. And I try to methodically run through the reasons why. And now, look, every study can be critiqued, no matter what you publish, and that's appropriate. Other experts in whatever field are going to look at it. And this study is not, removed from that same scenario. What they mention in the study itself is that they did not control for vaccine status of the staff or students.
That's amazing.
That, of course, that has an enormous impact on things. And there's that, and there's a whole other long list of things, Megyn, that they actually, which again, this is normal to have limitations in a study. That is typical, and people can discuss those methodological limitations, and that's fair. To me, what really caught my attention and what I became so engaged with were the things that they didn't disclose in the study. Those are the things that the experts on Twitter and wherever else weren't commenting on because they didn't know.
Mm-hmm. And the first one that you took a look at is, when were the schools open? The schools where the kids wore the masks, when and for how long were they open? And when and for how long were the schools where the kids did wear the masks open?
Right. So the study says it ran from July 15th to August 31st. So any regular person would assume, okay, that means all the schools are being studied for roughly 6 weeks, from July 15th to August 31st. But I started looking at the calendars for some of these schools, and I thought, that's weird. I'm seeing a whole bunch of schools that aren't opening until August. And eventually I ran through, and it turns out almost 90% of the schools weren't even open in July. So how could you say a study went from July 15th to August 31st when close to 85 or 90% didn't even open in the month of July? So this was something that was really worrisome, because what it does is that suggests a robustness that wasn't there. It suggests a certain time frame. We looked at them for this long time frame when actually the time frame was truncated heavily for many of the schools. In addition to
6 weeks, it was more like 4 weeks or 3.5 weeks. Okay, yeah, I got it.
Right. And not only is it in the study, but this is something that Rochelle Walensky mentioned multiple times in her public statements, talking about these schools began in July. One of the authors in an interview to the New York Times talked about, we have this great advantage with our study here in Arizona. The schools are beginning in July. And it just simply was not the case for, 80+% of the schools. It simply wasn't true. And then when you look at the dates, and here's where things begin to get more interesting, is that the schools in the study, you get an indication that the study looked at 2 counties, something called Maricopa County and Pima County. And the schools in Maricopa appear, when you look at the tables in the study, they appeared to be more associated with being the schools, disproportionately those without mask mandates. And when I was looking at these school calendars, I was like, I noticed that also those schools happen to be the ones that appeared to be more often to be opening earlier. So what does that suggest? It suggests that these schools without mask mandates possibly were looked at for a longer period of time. But that seemed not possible. How could they possibly do this in the study? So I emailed with the corresponding author on the study. And I said, hey, I've been looking at the calendars. I know your study says it runs from July 15th to August 31st, but I'm seeing a whole bunch of schools that on their official calendar says they weren't even open until, August 10th. And to my amazement, she did confirm, yes, there are many different start dates. Many of the schools in the study did not run for the full 6 weeks. And ultimately what we found was that there were schools, I think you just mentioned this, Megyn, that were only open for 3 weeks. So we have some schools that are open for 6 and some that are open for 3, double the length of time that they're looking at this. And here's where the kicker is. She did acknowledge to me that the schools without mask mandates were studied for a longer period of time.
Wow.
So I just want that to sink in. This is an invisible thumb on the scale. No one knew about this except me because I looked at the calendars, but all the media reports, all the stuff just saying, 3.5 times. It's a study. It went for 6 weeks. This is epidemiology 101. You can't compare two different groups looking for the incidence of something, but have one group that you're looking at for a longer period of time. I mean,
right.
a fifth grader could understand this concept. Now, I need to mention, the authors claim that even though they looked at schools for a longer period of time with the without mask mandates, that they said that wasn't a meaningful difference and that it wouldn't affect the outcome. But here's the thing. According to multiple experts who I talk with and who I cite in my article, they said very clearly, if you're looking at one group longer than the other, you must adjust for that. You can't just put it in there and not do a special calculation to equalize things. And that also should be disclosed in the paper. But there's no way to know that their defense, that they're saying, oh, no, this doesn't matter, because they've refused to share the data set with me. Over and over and over again. I kept asking for it, and they refused to share their data set that they used for the study.
And what do you mean by data set?
Okay, so any study looks at, a pile of data, so to speak. So for this study, they looked at outbreaks, the number of schools, the enrollment sizes in the schools, and their mask policies. So those are important pieces of data to keep track of. There is no way to verify any of the findings in this study unless you see all those pieces of data. Now, ultimately, after they beat me up for a month or so, and I eventually did a public records request where I compelled the state of Arizona to send me the damn list of schools, I was able to force one thing, which was getting the actual list of schools. But no one actually has the data on the number of outbreaks and the enrollment sizes or the mask policies. No one can see it. So when I emailed back and forth with the authors, and by the way, I looped in 5 different people at MMWR, which is the CDC's official journal, who published this study. I brought in the editor-in-chief. I had a list of people on these email exchanges, and they all backed up the idea. They wrote, you can read the quote if you have it. They essentially said, there are no errors. And I wrote back, I said, no offense, but I can't just take your word for this. How can anyone know this to be true when I'm literally telling you, and your lead author has acknowledged to me that there are different start dates. This is totally different from what's written in the study itself, totally different from what you've all been saying publicly about when the schools begin. We don't know what happened because you won't share it. And they said, yeah, we're good. We're not sending you anything.
Wow. And this isn't Tucker Carlson calling up and asking for the data, right? This is the Atlantic. They don't want a bad piece for them in the Atlantic. So there must have been a good reason for them. I mean, not good in our view, but good for them not to send it to you. Just a quick follow-up, though. If one of the things in the data set that they won't give you is the number of children enrolled in the classes, then it could be a situation where there were many more children possibly in the classes where people were not masked by mandate versus the classes where the kids did have to wear masks. So you could have a smattering in one classroom wearing their masks and then double that size in the classroom without their masks.
And that's exactly right. This is all conjecture. You can look at clues from the information they do give you in the study. They break the schools into four population categories. But from the experts I spoke with, that is not nearly precise enough to adjust for different enrollments. Now, remember, imagine you have a school without a mask mandate that's looked at for, say, 2 days longer than a school with a mask mandate. But if that school without a mask mandate has triple the number of students in it, maybe that's a huge school with 2,000 students, and the other one, only has 600 students or something like that. Those 2 days, in effect, become 6 days for actual per person exposure time that you're looking at, because in the end, that's what we're looking at. So again, the image I think of is there really was this invisible thumb on the scale, and had they disclosed this, now people could then argue about it and say something publicly and push for things. But to me, the thing that bothered me so much was that, at least to me, and I think to any regular person, when you see a study that says it runs from July 15 to August 31st, that certainly suggests that they're looking at all these things together, for that same duration of time. And it was just amazing that this kind of talking point about beginning in the middle of July was something that was repeated over and over, when it simply was not the case for 80+% of the schools. It didn't make sense.
No, it's dishonest. And there is much, much more. David did his homework, more on what he found and on whether we should be trusting the CDC and Rochelle Walensky right after this. Don't go away. Black Rifle Coffee Company is a veteran-owned coffee company serving premium coffee to people who love America. Veteran CEO and founder Evan Hafer spent over 7 years on the ground overseas with U.S. Special Forces and as a CIA contractor. Evan even modified his gun trucks during the invasion of Iraq to grind coffee anywhere. I bet you he was the most popular guy there. Coffee is more than a business for him. It is a true passion. Every morning while deployed, Evan would cheers his coffee with his team leader before heading out on patrols. And great coffee, it just has a way of grounding us, no matter where we are. For Evan, it reminds him of cold mornings, hunting in the Idaho mountains. Through coffee, Evan was able to experience that perfect morning every morning, whether he was in Kabul, Seattle, or anywhere in between. And that's what it can do for you too. There's nothing better than starting your day with America's coffee. Make your holidays better by giving the gift of Black Rifle Coffee. You want to support the cause? Just go to blackriflecoffee.com/MK today and check out the freshest coffee in America. America's Coffee makes your holiday shopping easy with personalized bundles, gifted subscriptions to the coffee club, gift cards, and a whole lot of premium coffee apparel and gear. Make your holidays better with Black Rifle Coffee. blackriflecoffee.com/MK gets you 20% off coffee, apparel, and gear right now, as well as 20% off your first month of the coffee club. So, in addition to the other problems that you found, let's go over a couple of more. One that I confess in reading the article I didn't totally understand. You said critics note the study's use of school-related outbreaks rather than cases per student per week. This somehow undermined the data. I don't get that. Can you walk me through that at a 101 level?
Yeah, it's a granular point, but the more precise you can be, generally, the better. And what you really want to look at when you're looking at the incidence of something like, COVID cases, is you want to look at the per person per week or per person, some block of time. But instead, they looked at outbreaks, which they defined. By the way, the word outbreak is very, very deceiving to most people. An outbreak simply means 2 cases within 14 days of each other that they say are epidemiologically linked, which could mean the kids were in the same classroom. That's it. So get that out of the way to begin with. When we hear the word outbreak, that has kind of like a scary connotation to it, but outbreak doesn't technically mean what most of us probably think it means. But when you're looking at outbreaks, those cases aren't necessarily linked in the manner that that word suggests. So it's far more precise to look at the number of individual cases you're getting in each school in that period of time. Again, because imagine you have a school with 5,000 kids and you have another school with 1,000. what's the likelihood you're going to have 2 cases in the 5,000 school versus 2 cases in the 1,000? Particularly, even if you had 5 schools with 1,000 each and 1 school with 5,000, you're still more likely to have that outbreak in the 1 school with 5,000 than you would having any 2 cases in one of those 5 schools with 1,000, if that makes sense.
Bigger populations will lead to bigger numbers of cases and bigger numbers of bad results.
And the way, and they didn't adjust for it in a manner that actually, that equalizes that discrepancy out. So that was something that a number of the people who I interviewed for the piece pointed out, that there's this, again, it's a bit granular for a regular person, but this, here's the main point. There are so many decisions along the way when you conduct a study. People think science, it's one way. There are an infinite number of ways that researchers can conduct a study. The methodology can vary incredibly widely, and then the analysis itself. So there's not only there are many choices that happen along the way. And these particular every single step of the way, it seemed like the choices they took in this study seemed to err in one direction.
Yeah. Oh, what a shock.
That's the takeaway, that when you put all the pieces together.
There was another one that I couldn't believe, which was when you finally, so you wanted to get, give me the list of schools that you looked at. They wouldn't. So you finally just went to the state and got a list of, well, give me all the schools that are in Maricopa County. And they had to give it to you. And what you found that was, in particular, was, first of all schools were not in Maricopa County. First, number one, they were not using all schools within Maricopa. And some of the schools, or at least one, we don't know how many, were virtual. So they were counting virtual kids doing remote learning in this study, which is absurd. I mean, you're going to explain it to me, but my thought was, all right, so little Johnny sitting there doing his Zoom school, wearing I don't know whether he's wearing, I assume he is not wearing a mask. He's not wearing a mask. He's spending all day with mom and dad and brother and sister inside of a home, unmasked, because he is at home all day. Maybe he's going to get COVID. How are we counting that against schools that, for the most part, have opened up with ventilation, with distancing, with teachers who are vaccinated, and all these other protocols?
So this point falls into that bucket that I talked about, where there are things there. Remember, Cheney, there are known knowns and there are, known unknowns. These are the things that were not disclosed. So we know that they didn't control for vaccination status, despite what the director Walensky said, that no, we know that it's definitely from the mask. They didn't control for vaccination status. We know that already, though. That's listed in the study. But the things that aren't listed were the dates that I talked about, this July business. And then as well, the other thing that wasn't listed is that they said there were 782 schools in Maricopa County that they, had involved in the study. However, I kept going back and forth with them, asking for the data. And then I gave up on asking for enrollments or outbreaks. I said, just give me a list of schools that's publicly available. And I had found that this got cut from the article. I had found a list online from the county, from the superintendent, and it said there were 757. I'm like, that's strange. The study says there's 782. How can there be 757? I then spoke to the superintendent of schools in Maricopa. He confirmed for me, yeah, 757. In fact, it may even be lower because some of the schools aren't open anymore, blah, blah, blah. Eventually, I got the list from the state. And then eventually, even after that, finally, they stopped responding to me, but my editor emailed them and they sent him their sort of winnowed down list. But even on that winnowed down list, there still were preschool, virtual schools in the initial list I got from the state. And by the way, in my public records request, I said, I want the list that you gave to these authors. Whatever list you gave them, give that to me. And they sent it to me and they said, this is the list. And on that list, there were schools that were closed. There were preschools. And the biggest one is there were something like 80 or 90 vocational programs that they were categorized as schools on this list from the state, but they are not schools. It's merely a program that you go to, whatever, XYZ high school, and you're taking an automotive class. they called that a school, but those kids were still there. They could go to a campus of these vocational schools. There were a few campuses where the kids could go there for part of the day, and then they come back to their home school. But those were only like 2 to 4 campuses. So you have 80 entries for regular high schools that they just call it an additional school, but it was not. And I went back and forth with the authors and back and forth with the editors. I know this term gets thrown around a lot, gaslighting. I thought I was losing my mind. And I talked with all of my experts behind the scenes. I'm like, I have spreadsheets where I'm comparing everything. I'm calling schools in Arizona. I spoke to the people at the vocational schools. They don't exist. And the question then remains, as you pointed out, how do you calculate the number of outbreaks in schools that don't exist? Those are not schools. Yet they have doubled down and they are insisting that they said, no, this is correct. No matter what evidence is presented to them, they ultimately, in the final communication with my editor, they said, well, if there's another error in the categorization, you need to take that up with the Department of Education. That may be so, but you conducted this study where you're saying there's 782 schools, but yet there are not those schools. How can you have more schools in the study than actually exist in this county?
It's a fair
how does that happen? No one knows.
Yeah, so their statement was MMWR, and again, this stands for Morbidity and Mortality Weekly Report, which is prepared by the CDC, is committed to quickly correcting errors when they are identified. We reviewed the specific items that you describe below and found no errors, which is, I like that. I'm going to start doing that. Like, no matter what, I found no errors in what I did. No, notwithstanding the fact that they maybe stare me in the face, right? Like, there aren't. Okay. That's not normally the way this works.
I basically told them, I'm like, look, it's raining outside. And not only am I telling you that, here's my proof. I'm soaking wet. And they wrote back and basically said, F you, it's not raining. I mean, that's essentially what the correspondence was. I mean, this was not. So that's the thing I keep mentioning. This is not about different academics, as they always should do, sort of critiquing and reviewing each other and saying, I don't like this methodology. You should have controlled for vaccination status. They also didn't control for community rates over time in this study, by the way. They only looked at it pegged to the first week of school. So if community rates started to skyrocket in some of these areas after the first week of school, that wasn't controlled for. So those things were known, but it's when I'm presenting, there's actual evidence, and it's not me, this pesky journalist. I'm like, this is from the state. I have their list. This is not me making stuff up. This is not me complaining about your methodology. These are the actual figures from the county of Maricopa and from the Arizona State Department of Education. And they are giving me different numbers than what you have in your study.
There are 80
I don't
phantom
understand
schools.
how you can tell me.
Okay, so now let me ask you about this. Going back to Rochelle and the CDC, because they really have been touting this. I mean, I want to call the superintendent of our school today and say, have you been reliant on her? Have you been depending on her information? Because I want you to read this. Let's put up the tweet so the audience who's watching on YouTube, they can see it, and I'll read it to our listening audience. This is just another representation of how she was putting it up. It's the CDC September tweet I'm asking for my team. And she tweets out, let's see, why do I keep doing this? I can't actually read what it's, there's still quite a lot of suffering going on. Yeah, I'm trying to, okay. Yeah, can you read? I'm trying to read it and it's too far away from me. Go ahead.
Yeah, so this is the tweet from the CDC, which Director Walensky ultimately retweeted herself a couple days later. It says, the new CDC MMWR finds schools in 2 Arizona counties without a mask requirement were 3.5 times more likely to have a COVID-19 outbreak than schools requiring masks from the start of the school year. CDC recommends universal masking for all K-12 schools.
All right, 3.5 times. And one of the points you make in your article is 3.5 times, like the masks are that effective. They're going to give you thruple and another half, the protection of not wearing a mask against getting COVID. And you said that right there should have raised alarm bells for people. Why?
So one of the reasons I got started on this journey of this investigation was that, I'm often texting and in correspondence with a variety of infectious disease people and epidemiologists who I'm just in touch with every day. And when this study came out, my phone, exploded with people saying 3.5 times. What? That's like way out there. And this type of comparative study, it seemed completely to be an outlier type of result based on where you're comparing these things, as you're suggesting. That's, 350%. By comparison, another study, which I dismantled, one that took place in Georgia schools, found something in the 30s%, and that was for staff. And for students, the percentage was 21%, and it wasn't even statistically significant. So when you're talking about 30-something%, and there's a big randomized control trial in Bangladesh. It wasn't on schools, but even that found something like an 11%. So when something about this just was like, whoa, it started ringing alarm bells, and my phone started blowing up, and I'm like, maybe I should look into this. When something seems more dramatic than what typically makes sense, you want to look at it and figure out what's going on. And sure enough, when to use a cliche, once you looked under the hood, things started to look very worrisome. So the thing to me, Megyn, that I found, and I didn't get to go into this in my article, but I felt a sense of betrayal. I was surprised at how I felt this way for the past, almost 2 years. I'm surprised at how naive I've been for someone considering how cynical I am, that I still felt like hurt and surprised. I remember I was talking to my wife the night I got that response from the editors at the journal from the CDC when they're like, thank you, there are no errors. I was just like, I could expect this maybe from like the CIA or something in our intelligence, apparatus. I was like, this is a public health agency. Like, what are they doing? Yeah. And when I sent that response to several of the experts who were working with me, we all just felt the sense of betrayal and astonishment at the way their messaging played out with this, even with me. So that to me is obviously the broader point than just this one study, right? Mm-hmm. It's the notion of,
well, it's infuriating because we have millions of Americans kids with masks over their face all day, and it's not necessary. And we have yet to be shown the science that proves otherwise. This is the quote science. Doctors Fauci, I am the science. This is the science. Well, the science doesn't hold up. This is junk science. This does not justify my kid wearing a mask over his face all day. So show me something that does. But you're right that the larger point, apart from the inconvenience and the social distraction and the just soul killing nature of children having these masks on their faces all day, is we don't trust our public health officials, and for very good reason.
I think that's ultimately what this comes down to. And look, whether people think we should wear masks or not in schools, okay, that can be debated. That's a policy decision, but policy and science are two different things. So if the CDC is welcome to continue to make the argument that they think masks are important in schools, but they simply can't use this study to make that argument in the way they did over and over. And they can't use a variety of the other studies that they have been using.
But what it shows is that they're willing, I'll be charitable, to push the envelope. They're willing to bend the truth if they think it's in service of the greater good. They believe already that masks have to work. Masks are the answer. Masks do work. And therefore they do the study. They overlook the flaws. They don't care when it's brought to their specific attention. They put their heads in the sand because they believe this is what's right. If we put something out there saying anything other than they work, it can undermine what's right. It is exactly the same thing as Fauci and his noble lie about the masks and noble lies about what levels we need to reach herd immunity. They've done it over and over, and most of us are done trusting them.
Yeah, that to me is the big, and there's a quote from Jonathan Ketchum, who's a public health economist who I interviewed for the article at the end, where he said, ultimately, this is really about a loss of trust. It's not about this one particular study. It's and by the way, I said, hey, if you don't trust me as the pesky journalist, I have a list of highly credentialed experts who are very concerned about this study, and I can have the request come from one of them if you don't want to give the data set to me. Give it to, so I even offered that up. I was like, hey, I get it. If you don't want to send it to me as a journal, give it to but what people need to know is MMWR, the CDC's journal, does not have external peer review, which is considered kind of the rock bottom standard for most of our top journals in the country. So there's no review. So when you have someone presenting you with very specific evidence from highly, legitimate sources like the state of Arizona and the county of Maricopa, and I'm showing them this evidence and they say, nah, it's fine. And there's no way for anyone to verify any of this, Megyn, if they don't give the actual data set and let other researchers look at the underlying data. And the little bit that I actually got when I looked at the list, lo and behold, there were schools that were closed. There were schools, kids in the virtual academies on this list that are in their study. No, it's a black box. No one knows how they came up with their ultimate findings on the study because none of this makes sense or adds up. And it is so demoralizing and to know that a public health agency has been acting in a manner that we would more typically associate with something, like bad corporations or, something in the Defense Department or whatever.
Right. It's like, so I think a lot of people distrusted the CDC before this, but it is important to see actual proof, right? It's like, my instincts were right. They were lying and now they're lying more. And, I've said this before, but in the law, if you catch a witness in a lie, you can ask for a jury instruction to the jury. It's basically falsus in uno, falsus in omnibus. My Latin's falling apart, but it's, if they lied in one thing, you're entitled to determine that they're a liar overall and disbelieve their testimony. Gotcha, Rochelle. Gotcha, Fauci. Over and over. But I want to do more with this. I want to replay that soundbite and ask you something specific. And then I want to ask you about what they're doing with the vaccines, because Biden, he's sidelining the officials when it comes to pushing through these boosters and things for children. And given the fact that already they're sort of jumping right over things we might want to be concerned about, that's alarming too. We're going to pick it up there right after this quick break with David Zweig, one of the last few honest journalists out there. Legit. And remember, folks, you can find the Megyn Kelly Show live on SiriusXM Triumph Channel, 111 every weekday at noon East. Okay, that's for my YouTube and my podcast followers. If you want to catch me live, that's where to do it. If you like to watch the show, just go to youtube.com/Megyn Kelly. You can watch the whole show or just clips. And if you prefer an audio podcast, which is how we began, just an audio podcast, which is lovely, then go ahead and subscribe to the show and download the show on Apple, Spotify, Pandora, or Stitcher. It's free. You can consume it at your leisure. All right. And you'll also find our full archives there with more than 220 shows. Thank you for doing all those things, ideally. I want to talk to you about Blue Blocks and their amazing blue light blocking glasses. Since getting a pair of these amazing glasses, I have had no more headaches or fatigue when looking at the computer screen or my phone or watching TV. I wear them when I'm using digital devices. They've been a game changer for me. They come in non-prescription, prescription, and reading options, and they are made in an optics laboratory in Australia with fast shipping to the US. I also wear their Sleep Plus glasses 2 to 3 hours before bed, and I have not slept this well in years. They're so good. I highly recommend getting a pair for yourself, and you will be amazed with how well you feel after just one use. My favorites are the Aero Sleep Plus glasses, and I also love their Remedy Sleep Mask, which is 100% blackout, and that gives you the best night's sleep. Just go to blueblocks.com/MK. Use the code MK to save 15% off your order. That's BLUBLOX, Blue Blocks, BLUBLOX.com/MK, and use the code MK to save 15%. In the wake of all that, I want to go back and take another look at Rochelle Walensky and what she said, because what he's trying to get to at the end, as you point out now, is, okay, so great, there's this study, all the kids should be masked, got it. But is it just something like, did the data show masks help? Masks are one of 5 things that help reduce the spread of COVID. Or were you able to specifically say, no, it's the masks that caused this 3.5 time reduction in COVID? Let's listen to it one more time.
You know, the big finding is that masks in school work. We've only had in some school districts about 6 weeks of school, and we've already had in a different study that was published today, over 1,800 schools closed. Nearly a million children have been out of school because of school closures. But the study that you're referring to in Arizona demonstrated that schools that had masks were 3.5 times less likely to have a school outbreak than schools that didn't have masks.
Just as to follow up, are we sure that's not a correlation issue and not a causation, which is to say, like, there's higher levels of community transmission in the school districts that are also the ones most inclined to not have a masking policy? See what I'm saying?
Yeah, no, and that's actually been studied as well, and we've examined those correlations for exactly the concern you raised. This is an independent effect of masks.
That was a lie.
Well, what I can say is every single one of the experts who I interviewed for this article, I think there were at least 3 or 4 or 5 quoted in the article, and I had a list of them who consulted with me off the record for the article as well. Every single one of them was very specific and scathing in their assessment that this study absolutely did not say what the CDC claimed it was saying. They didn't control for vaccination status. They didn't control for community rates over time. There's the way they did their adjustments for population correlations. I mean, the list goes on and on. So I'm not going to use those words, but I will say that what the director Walensky is saying is in 100% direct contrast to what every single expert I interviewed about this study said to me. And if you read in the article, I think it's a fairly persuasive case that they are correct.
Yes, I'll be charitable here and say it's not true. Her best case scenario is she was mistaken over and over and over and over and over again. And then when confronted with that mistake by you, she refused to give you a statement. The CDC refused to comment. When confronted with your article and your reporting by us, they refused to give us a statement or to clarify in any way. That suggests a lie. I mean, look, you're too nice to say it, but I've been around this for a while. If you won't explain it and you won't correct it, you lied, and you're standing by your lie because you think it's noble, I guess. But it plays into what's happening right now, and I'll just get you a comment on it quickly. In the past couple of weeks, we've had 3 important decisions on vaccines. WAPO has an article on this today. FDA authorized boosters for all adults. Everyone under 18 now should get a booster shot, they say, and booster shots for 16 and 17-year-olds without the standard practice of convening standing outside advisory committees whose members would have objected. They're now bypassing objections at all for their favored policies, David. I think it's downright alarming. I'll give you the last word.
Yeah, I would share your alarm with that assessment. Boosters certainly appear to be a really good idea for people who are older and people who have various vulnerabilities, but and again, before I knew I was coming on, so I double checked with a bunch of my experts this morning. There's no evidence that they are aware of that giving a 16-year-old a booster offers anything. Remember, you're dealing with a population when you're talking about kids and adolescents where something at least around 50% of them are asymptomatic. That is an incredibly high bar to clear.
And they're not facing any serious, they're not facing virtually any risk at all of hospitalization or death. David Zweig, you're an important person in the national conversation. I'm grateful to know you and for your reporting. Thank you.
Thanks for having me, Megyn.
Wow, we got to get an answer from Rochelle.
People keep asking if I'm back, and I haven't really had an answer. But now, yeah, I'm thinking I'm back. If I said it, I meant it. Bite my tongue for no one.